Let's be honest for a second.
Sure.
Trying to figure out your healthcare costs.
Yeah.
It's like trying to decipher ancient Egyptian hieroglyphics.
Yeah.
Sometimes,
I know, right?
And then on top of that,
Yeah.
you got to try to find some affordable options.
Right. Yeah.
The whole other puzzle on top of that one.
It really is.
So today we're diving into this review
Okay.
that claims that this one platform may just have it all figured out,
Interesting.
especially if you're out there on your own
Yeah.
without insurance.
Right.
And it's called Sesame Care.
Sesame Care.
Have you heard of this?
I have heard of this.
They're making a lot of noise about much lower healthcare costs.
Okay.
And their whole thing is ditching insurance completely.
Wow.
So we're looking at this 2024 review from ThriveX Dana. They're all about financial and health planning.
Right.
He seemed pretty impressed.
Okay.
But of course, we're going into this with a critical eye.
Of course.
Because if it sounds too good to be true, it probably is.
Exactly.
What do you think so far? Anything stand out to you?
Well, I think what's really interesting here is that there really is this huge movement toward transparency in healthcare.
Yeah.
I think people are just tired of feeling like they don't know what's going on.
Yeah.
Just at the mercy of this huge system, and
then boom.
they get these surprise bills,
Yeah.
paperwork.
Endless paperwork.
Nobody has time for that.
Nobody.
So I think that's really what Sesame Care is tapping into here.
Okay, so right off the bat,
Yeah.
they're saying they're the direct-to-consumer alternative.
Right.
So basically, Skip Insurance will connect you right to the doctors.
Interesting.
It's like when you buy a plane ticket.
Okay.
You could go through a travel agent,
Right.
or you can go direct through the airline.
Right. Right.
Cut out that middleman.
Yeah.
And they're betting that translates to savings for the consumer.
Okay.
And listen to this.
Yeah.
It's not just doctor visits.
Yes.
They've got a whole range of services.
Like what?
Dermatology,
Okay.
mental health,
Interesting.
even prescription refills.
Wow.
All starting at $29.
$29.
I know.
Really?
That's what they're saying.
I mean, how is that?
My first thought, like
Yeah.
how?
I mean, sometimes my insurance copays are more than that.
Right.
Yeah.
That's the $10 million question, because that's how much the review claims they save their users.
Wow.
$10 million.
Okay, but let's
Yeah.
say it's $29.
Okay.
What are you actually getting for that?
Right.
Is that just like a 5-minute,
Right.
how are you?
Your
Prescription? Yeah. Are there hidden fees?
And what about the doctors?
Yeah.
I mean, are we talking about experienced professionals here?
Right.
Or are these people fresh out of med school?
That's a big difference.
Huge.
Yeah.
This is healthcare.
Right.
We can't cut corners on quality.
Absolutely not.
And that's where I start to get a little wary of this direct-to-consumer approach.
Oh, yeah. How so?
Well, it's not like you have a network of providers.
Right.
It's not traditional insurance. So,
You're putting a lot of trust in Sesame Care
exactly.
to find good doctors.
Yeah.
To have done the vetting for you.
Right.
Yeah.
So then that begs the question,
Yeah.
what happens if something goes wrong?
Oh, that's a great point.
Right.
What if you need more?
Like, what if it's not just a quick virtual checkup?
Yeah.
What if you need follow-up care?
Right.
Or something way more complex?
Are you on your own then to figure it all out again?
Right, and then you're back to square one.
And back to those expensive bills probably too.
Exactly.
Yeah.
And speaking of figuring it all out,
Okay.
let's talk about user experience.
Right.
So the review mentions Sesame Care being super convenient,
Okay.
easy to use,
Sure.
but again, it's coming from them,
Yeah, of course.
not from us,
Right.
not from actual users.
That's right. We need to go beyond the marketing and see what people are actually saying. What are real people's experiences?
Right.
Are appointments easy to book?
Can you get in to see someone quickly?
Right, because what if you're waiting weeks to get an appointment?
Exactly.
That's not very convenient. You know what I mean?
Yeah, that defeats the purpose.
Exactly.
So we need those reviews.
Yes, we need the detail.
I need the nitty-gritty.
Not just star ratings.
Right.
We want the good, the bad, and the ugly.
Like when you read restaurant reviews.
Yes, exactly.
See 5 stars, you're like, okay, great.
It could be 5 stars, but the service is terrible.
Right. Or the portions are tiny.
Exactly.
We need those details.
We want the full story.
Yes.
Don't just limit yourself to one source either.
Oh, absolutely not.
Check out different platforms.
Yeah, do your research.
Are there any red flags?
Right. Are there things popping up consistently?
Yes.
Or is it smooth sailing?
Exactly.
It's like doing a background check on a potential roommate.
100%.
Right. You want to get the full story before you sign that lease.
Absolutely.
And speaking of the full story,
Okay.
we need to consider where this review is coming from.
Right.
ThriveX Dana.
Okay.
They're all about financial and health planning.
All right.
And what's interesting is
Yeah.
they're praising Sesame Care,
Yeah.
but they're also like low-key reminding you that traditional insurance exists
Okay.
and that there are other low-cost options out there.
Interesting.
And they even link to insurance quotes right there in the review.
Oh, wow. That's smart.
It's like they're saying, hey, the Sesame Care is pretty cool,
Yeah.
but don't forget about us.
Yeah. Right. We can help you with all the other stuff, too.
Exactly.
That's a really good strategy.
It is.
Yeah.
They're giving you information about Sesame Care,
Right.
but they're also positioning themselves as a resource
Yes.
for traditional healthcare solutions.
Smart.
Which brings us back to the listener.
Okay.
How do you take all this information
Yeah.
and decide if Sesame Care is right for you?
That is the question, isn't it?
Yeah.
That is the question, isn't it?
It really comes down to knowing yourself
Mm-hmm.
and your own healthcare needs.
Right.
Would you agree with that?
Absolutely, yeah.
This isn't a one-size-fits-all situation.
Nope.
Sesame Care could be amazing
Yeah.
for someone who's generally pretty healthy,
Right.
doesn't take a lot of prescription medications,
Right. Right.
maybe just needs those routine checkups,
Mm-hmm.
or the occasional urgent care visit.
Yeah. Totally.
They're saving money up front,
Right.
and they're getting convenient care.
Yeah.
But for someone with a chronic condition
Okay.
that requires specialists,
Yeah.
regular treatments, maybe even surgery at some point,
Right.
this whole pay-as-you-go model
Yeah.
could end up costing a lot more in the long run,
It really could.
especially if those $29 appointments turn into something more serious.
Exactly. Something more complex
Yeah.
and more expensive.
Exactly.
Yeah.
It's like when you're trying to decide
Okay.
between a sleek little city car
Okay.
or a sturdy SUV.
All right. I'm following you.
The city car is great for zipping around town,
Yeah.
saves you on gas.
Right.
But if you're planning a big road trip,
Yeah.
packing up all your stuff,
Right.
you're going to want that SUV.
You need the space.
Exactly. You need the space.
Yeah. And you need the dependability.
And the dependability, yes.
Yeah.
Okay, and let's not forget about insurance.
Right. The elephant in the room.
Exactly, the big one.
Yeah.
So Sesame Care is designed to replace traditional insurance.
Yeah.
But what if you already have coverage
That's a great point.
through work, through a partner?
Right.
What do you do then?
It changes things.
It's apples and oranges.
Totally.
You'd need to dig out your insurance card.
Find that deductible.
Yes.
See if it even makes a difference.
Exactly.
No-
See if it even makes sense.
Yeah.
And then on top of that,
Yeah.
are Sesame Care doctors even in your network?
That's a really good question.
It's a lot to think about.
It is. It really is.
It can feel overwhelming,
It really can. Yeah.
but that's why we're here.
That's right. We're untangling it together.
One thread at a time.
Exactly.
But remember, the most important voice in all of this is yours.
100%. You have to advocate for yourself.
Be your own advocate.
Yes.
Reach out to Sesame Care.
Ask them the tough questions.
Ask the questions. Get those details.
Yes. Yes.
What are some key questions
Well, I would say
our listeners should be asking?
I would start with, what happens if I need more than just a basic consultation?
Okay.
What's your referral process look like?
Okay.
What's your network of specialists like?
Good question.
How do you handle pre-existing conditions?
Yes. Those are so important.
And of course, ask about hidden fees.
Oh, of course.
Are there extra charges for labs, prescriptions, after-hours appointments?
Right. You don't want any surprises down the line.
Exactly.
And I would say, too, if you're thinking about dropping your insurance completely,
Okay.
it's worth chatting with a financial advisor,
Definitely.
someone who understands your finances.
Well, they can give you the full picture.
They can help you assess the risk and benefits,
Yeah, based on your situation.
because knowledge is power,
Right. Absolutely.
especially when it comes to your health and your wallet.
Couldn't agree more.
We covered a lot today,
We did.
but hopefully this deep dive
Yes.
will help you make more informed decisions
More informed decisions about your healthcare.
about your healthcare.
Yeah.
There's no one right answer,
Right.
but if you do your research, ask the questions,
Advocate for yourself.
you can navigate this healthcare maze with confidence.
100%.
Until next time, stay curious, stay healthy, and don't be afraid to dive deep.
Love